Thanks, Devin. With summer now in full swing, we are taking the boats, grilling out, and having campfires. These fun summertime activities could put you or a loved one at risk for burns. So here to give us some tips on burn preventions and treatments is Nurse Christina. How are you doing today?
Hi, good.
Good. So our skin does a lot, but what exactly does the skin protect us from?
It's actually an organ, your skin is. Yep.
Yeah,
and not only does it hold everything in, but it regulates temperature. It helps prevent infection. So it has a lot of things that it does.
Okay. All right. So our topic today is burns. Can you go in the differences between first, second, and third degree burns?
Yep. So actually, we don't call it first, second, and third degree anymore. It is now superficial. Superficial, partial thickness, deep thickness, and then full thickness. I know, we get really complicated. Okay. But anyway, so a superficial, or used to be first degree, is like a sunburn, which we have had a conversation about.
I may have had one.
You may have had one. Yes, so even though the water temperatures aren't super warm, but if you're still getting out there, you can get sunburned, even on a day like today when it's overcast. So you want to make sure that you're wearing sunscreen. Then we have those deeper thickness burns that you get, like if you are grilling out, or you happen to get injured by the fire pit, or even with fireworks.
And that's usually a blisters related to that?
Correct. So when we're thinking about the superficial partial thickness, so you're kind of going into the second layer of skin. So you could have a blister form, or it could even go deeper and into the muscle. Okay, and then
I'm going to still call it third degree burns.
Yes, that's fine.
So what does that relate to?
So those are deeper. Those are going to go down deeper into the tissue, and that's going to be, you're not going to probably see a third degree burn from, and I'm sorry, medical doctors, if I'm incorrect on this, but from a sunburn. But blisters you can certainly have. But if you are, again, playing by the fire, not paying attention, my nephew one time fell into the fire just goofing around, right? So it's easy to do, and you can get some serious burns.
Okay, so right after a burn happens, what should we do, and then how can, at what point should we start to go for like outside help, medical help?
Right, absolutely. So the one thing you really want to make sure you do is stop the burning process. So if it's your clothing that you have on, take it off, remove the clothing or anything that's causing that burning process. If it's just from being outside, go inside, shelter, cover your clothing, cover your skin. You want to make sure that you cool things down. So if a burning is still occurring, you want to cool it off. You can treat those burns by lifting the area. So if your hand is burned, for example, lift it higher than your heart. It'll slow down the blood flow to that area. And then keep it covered with dry bandage. Now you want to see a provider if it involves your face, hands, feet, any kind of genitals. If it's near your a joint, like your elbow, your knees, and if it goes all the way around the skin or the arm or the leg, something like that, because that can compress all of your blood flow and things. So you want to get into a doctor for that. And if it goes deeper than just surface level, or if you start to see if the clothing that you have on is sticking to the burn, you can't remove it, then you want to go to the doctor, emergency room right away.
And that could prevent, that could cause an infection?
Absolutely. So it's signs of infection. You're going to have that fever. You're going to have that redness. You might have any purulent drainage, so kind of white, crummy. It might start to smell. And if you don't know when you've had your last tetanus shot, you want to go into the emergency room.
All right, very good tips there, Nurse Christina. That's great to learn this, especially as the summer starts to come into full swing.
Absolutely,
so thank you.
We want everyone to stay safe and use sunscreen.
Yes, so, well, thank you for coming in. We'll see you again next week.